Miss Valerie Clark,
Present.
Miss LaVon Lewis, Angie Wilson, Dr. Tara Rains,
Present.
Ann Jensen.
Present.
Thank you. All right, and Jack, you're here until Ned gets here. Melissa Bullock,
Present.
and Melissa, thank you. You are the permanent designee for Laura Rich, who's the administrator of DHS Division or Department of Human Services. And then do we have our ex officio delegate, Tiffany Greenemeyer?
Present.
Thank you. All right, Jenna, or I think we have a DAG sitting in Jose's place. Am I okay to move forward?
Hi, this is Veronica sitting in Jose's place. I believe you guys are.
Okay. Thank you so much. All right, I'm now going to open up public comment. This is the second item on our agenda and offers opportunity for public comment. No action may be taken upon a matter raised under the public comment period unless the matter itself has been specifically included on an agenda as an action item. So if anyone would like to provide public comment either through the phone or through Teams, please unmute yourself, raise your hand, or if you're over the phone, you'll have to dial a specific number, and when prompted, you'll provide the meeting ID. So if anyone needs those instructions, please let me know.
We have Brian Douglas with his hand raised.
Yes, Brian, please go ahead.
Thank you, Janelle. Yeah, normally don't attend these, but wanted to at least attend this one and just thank the exchange for and everybody that was involved in getting the broker some compensation for the battle-born state plans. We recognize that this is something that the carriers should be doing, and they're doing in every other state. Hopefully that's something on the plan for next year, but I just wanted to thank you guys for putting something together for the brokers because they're all very happy that they're not working for free. So thank you.
Thank you, Brian. Appreciate your public comment.
Absolutely.
And thank you for joining our board meeting today.
No problem.
All right, I'm not seeing any other hands raised at the moment. There will be another opportunity for public comment at the end of the meeting. Jenna, do you have or do you see anybody on the phone?
I do not.
All right, moving on for possible action. This is agenda item number 3. We're going to review and approve the meeting minutes from our last meeting, which was on December 22nd of 2025. These meeting minutes were distributed to board members prior to today's meeting for review. Do any of the board members have any questions about meeting minutes or recommended edits? And if there are no issues, comments, questions, or concerns, we would like to call for a motion to approve the minutes as written.
I'm happy to make a motion to approve as written.
Valerie Clark, second.
All right, motion carries. Everyone say aye or yes.
Aye.
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 Janelle, I'm abstaining from voting.
Understood. Thank you for mentioning that.
And the commissioner is going to be later than planned due to unforeseen circumstances.
Understood. Okay, thank you. All right, Veronica, is that okay for us to move forward to the next agenda item?
Yes.
Okay, just wanting to make sure. All right, thanks everyone. And Jenna, if you can put the executive summary up on the screen. Thank you, Jenna, for sending the meeting materials to the board members. And if those attachments didn't work, these will be posted on our website. Probably for future meetings prior to the advisory board meeting, and we'll also send the board materials prior to the board meeting. So appreciate everyone's patience as we kind of work through the new timelines and the new advisory board processes. But we'll go ahead and get started on the executive summary presentation. All right, we can go to the next slide and review the agenda, please. All right, so kind of a hefty agenda, but I promise I will not bore you, and this will be an exciting presentation, I hope. We are going to talk about the carrier premium fee. We are going to go over, really, this is, sorry, previous slide. We're still just going to review the agenda. Really, this is a presentation to talk about post-open enrollment. So we're going to go over the 2026 enrollment metrics. We're also going to talk a lot about our call center. I believe this will be the first time that a lot of you guys as board members have heard about our call center. So wanted to talk a little bit about the metrics that we saw over the open enrollment period and as we go into 2026. We'll also talk a little bit about the work that we do with our certified brokers and navigators. Katie Charleston, our communications officer, will go over our marketing and advertising campaign success. And that is inclusive of web analytics, PR, community outreach, social media, and multicultural communication. And then I will close this presentation with a 4-month look ahead and what we're working on for the remainder of the year. All right, we can go to the next slide to talk about carrier premium fee. All right, so I'd like to provide the board with some information regarding adopting the 2027 exchange carrier premium fees. Previously, for plan year 26, the exchange board had voted to set the carrier premium fees charged to insurance carriers participating on the exchange marketplace at 2.95% for qualified health plans and 2.95% for qualified dental plans. This was voted on in February of last year. So what we're proposing for 2027, and then we'll kind of go into a comparison with the federally facilitated marketplace or healthcare.gov. We're proposing to increase the carrier premium fee for plan year 2027 to 3% of the pre-subsidized premium generated by qualified health plans and qualified dental plans sold through the exchange. So the exchange is required to develop an annual fee, and what this CPF or carrier premium fee does is allows the agency to perform all duties imposed by the state or federal statute without unnecessarily increasing the premiums paid by Nevadans for insurance plans through nevadahealthlink.com. So the Division of Consumer Health Services and exchange staff reviewed the legislatively approved budget, existing and projected cash reserves, the most recent enrollment figures, and a historical year-to-year premium adjustments and anticipated expenses to develop the recommended fee of 3% of the pre-subsidized premiums generated by qualified health plans and qualified dental plans. Staff believes increasing the CPF rate to 3% for plan year 27 will allow the exchange to continue our important state-based work while continuing to provide a lower assessment to insurance carriers at a flat rate. The proposed fee structure not only allows for increased transparency, but it will also keep providing budgetary stability and greater detail about the share of costs associated with the operations of a state-based exchange in the face of uncertain future federal and state rules changes. So this proposed fee of 3%, the flat rate, is a combination of actual and projected numbers. Actual premiums reported to the exchange for plan year 25 are the foundation for the proposed rate. In order to forecast future revenues, the actual premiums for plan year 25 were applied, with projected premiums increasing for plan year 26. Similar projections have been developed for calendar years 2027 and 2028 to assure data and calculation consistency with prior results. The CPF for plan year 26 was approved by the Exchanges Board back in February of 2025, and again was set to 2.95%. Due to the uncertainties faced from the future state and federal rule changes, we are we are proposing to increase CPF at a flat rate of 3%. Again, I think this will ensure sustainability of continued exchange operations while also keeping costs down for carriers and Nevadans respectively. I'm going to pause there because I know that was a lot for just one slide. And previously, this was a voting agenda item, but since this is an advisory board, this is just informational. So if there's any discussion, questions, comments, or concerns about the carrier premium fee, now would be a good opportunity.
Hi, Janelle. Thank you for this rundown. This is quite helpful. I'm curious on the history of these premium increase. It sounds like it has increased fairly significantly between or maybe I'm misreading the question at the bottom, but I just want to understand prior to February 2025, what has this fee looked like and how has that changed over time?
Yeah, that's a really good question. I can get you some historical documents, previously what the advisory or what the exchange executive board had voted on. But prior to transitioning from a state-based marketplace on the federal platform. So we were kind of a hybrid model utilizing healthcare.gov for eligibility and enrollment purposes. We tried to align very closely with what the federal government had set their carrier premium fee at. And prior to us transitioning, we did not pay a fee. And so back in, I think 2018, 2019, that's when we transitioned away and became our own state-based exchange. Healthcare.gov, they started to implement the carrier premium fee, and it was very expensive to remain on healthcare.gov. So we were able to transition and stay at or around the rate that healthcare.gov was providing to other exchanges utilizing their platform. So I believe we started at probably like 2.5%. And Jennifer, maybe you might remember this as well, just as or if not better than me, as the finance person at the exchange at the time. .95%.
Thank you, Janelle, and good afternoon, members of the Advisory Board Committee. Janelle is right. In 2020, when the exchange first transitioned to a state-based exchange, I believe we set our carrier premium fee at around 3.15%. So we have been seeing some reductions over the last couple of years in our annual carrier premium fee in plan years prior to 2020, so plan year 2019 and historical. We did still assess a carrier premium fee to carriers for every plan that had been sold on the exchange. However, those revenues and those fees were used to pay the user fee to CMS for the use of healthcare.gov. Now that the exchange is a state-based exchange and operating as a state-based exchange for its 6th year, we're using these carrier premium fees to pay for our own technology and call center platform, as well as our marketing and our outreach, as well as our operational costs for the state-based exchange. So the fees, I think, Director or Administrator Jensen, that you may be referencing, the 1.8 to 2.5%. Those are actually the fees that CMS charges to states who do not have a state-based exchange at all, but they completely rely on CMS and the federally facilitated exchange. Those fees have risen from 1.8% to 2.5% of premiums that are beginning in 2026. The difference is that they don't have their own state staff within those states who operate in exchange like we do here in Nevada. Operate state-based exchanges. So those are fees that are paid directly to CMS for the use of healthcare.gov as well as their call center.
That's super helpful. Thank you, Jennifer. And also I just look back on some historical board meetings and it looks like we did start at the 3.15%. So we have experienced some reductions and some savings.
Got it. Yeah, thank you both for that context. That's incredibly helpful.
Sure, of course. All right, I think we can move on to the next slide, Jenna, please. All right, so we have concluded our plan year 26 open enrollment period. We concluded open enrollment back in January 15th of this year. There was a 5-day window for enrollees who completed an application but had not yet selected a plan. So they had until January 20th to select that plan. And as we concluded for plan year 2026, we saw over 107,000 Nevadans enrolled in health and dental coverage through Nevada HealthLink. And so in the next couple of slides, I'll talk about the enrollment in more detail, but overall, we saw 104,286 enrolled in health insurance coverage, with 20% also adding a dental plan. Nearly 3,000 individuals chose a dental plan only. More than 20,000 people were brand new enrollees, while over 42,000 updated their existing plans. Broker and navigator assistance continues to play a major role. We definitely do a lot of outreach and education about this. Insurance can be confusing, so we want to make sure people are utilizing free in-person assistance or over the phone assistance. But that a broker or navigator that supported almost 70% of all of our enrollments. And then among shoppers who changed their plans, we saw an average savings of less than $280 a month. So the next slide, there's a little graph here. We can go into a little bit more of the data, but again, we ended up with about 107,000 unique enrollees. So comparing this to last year, we ended open enrollment with about 113,000. So we did have a very successful open enrollment. I think given with all of the policy changes that all exchanges experienced, that was the biggest one was the expiration of the enhanced subsidies. There were a lot of other changes that happened this year, increase in rates, for example. So I think, this data shows that people are still prioritizing their health and having health insurance coverage, and that's really important, and that's the message that we try to get across. You'll notice that most of the enrollment is in Clark County, followed by Washoe County. The majority of exchange enrollees fall between the 138 and 200% of the 250%, of the federal poverty level. And then almost half of the enrollees are around 45 years old or older. All right, we can go to the next slide, please. So this slide summarizes the 104,000 unique enrollees with a health plan directly following open enrollment. And so that includes enrollees with both a health and a dental plan. About 6,600 were in pending status and the rest are in confirmed status. And what that means is that they have made their binder payment. So they have paid their insurance carrier directly so that their plan can effectuate. The number of confirmed is active enrollees. So this was around the 56,000 mark, includes new enrollees and passively renewed enrollees who made updates to their enrollment and have made their binder payment as well. This number is around 30% higher than open enrollment last year. Excuse me. Also summarized on the slide, around 82% of health enrollees receive advanced premium tax credits. So again, Nevada Health Link is the only place where you can receive those that financial assistance to help offset your monthly premium costs. So that's a really good chunk of people who are receiving APTC. About half are enrolled in a cost sharing reduction plan, and most enrollees choose a silver plan, followed by an expanded bronze. Also, we saw expanded bronze increased by about 8,000 since last open enrollment period. Again, I think this is attributed to the expiration of the enhanced premium tax credits. And so we saw a lot of movement from silver plans to bronze plans. The federal poverty level and age breakdowns are similar to the previous slide on this slide. The target market includes FPL between 138 and 250, and again, above age 45 and up. Okay, we can move on to call center metrics. So this reporting period and the numbers that I have for you in the following slides are for the month of January, which is when open enrollment concluded, and we haven't done our February analysis, so I thought it would be helpful to see the month of January. And just to note, the exchange or Nevada Health Link, we have a federal requirement to operate and maintain a customer assistance call center for any Nevadan enrolling in a qualified health and dental plan. So we are also required to provide consumers with access to a live call center during the exchange's published hours of operations, and a live customer service representative must be available to assist consumers calling in. They can also assist with filing their exchange application, including providing consumers with information on eligibility, tax credits and cost sharing reductions, and then facilitating a consumer's comparisons of QHPs. So Get Insured, or now referred to as VMO, is our contracted vendor for our call center. They are also our technology vendor, but also for call center operations. The customer service representatives, they manage what we call Tier 1 calls. This consists of things like password resets for accounts, for example. Tier 2 calls, the CSRs also help consumers with. These are more in-depth communication. These consist of account access questions. And then Tier 3 calls are actually handled by exchange staff. So that's internal staff from the exchange. And they are part of our quality assurance team, and we have a quality assurance manager. And so these Tier 3 calls are more complicated account issues that may arise and usually require more in-depth communication with insurance carriers. So the total calls offered in the month of January were 17,297, and the calls connected were 10,100. I do want to highlight that our busiest day during open enrollment period was December 15th, even though that's not really a deadline day anymore since open enrollment ends January 15th. For some reason, December 15th is a big deadline day for a lot of people. So we had around 1,500 calls connected. The hold time was around 3.8 seconds and an average handle time of about 12 minutes. The main primary call reason usually is around enrollments, right? We also have data matching issue tickets. So these are maybe for people who have an existing application or an existing plan, but they need to make a change, and then a DMI is issued and they have to provide documentation to verify that data matching issue. So then tickets are created for those requests, and that's another really big primary call reason. And then just general application assistance. All right, next slide, please. All right, this is just kind of summarizing the call volume in the customer assistance call center. Again, this reporting period is for the month of January. We do have existing service level agreement goals within our contract with the call center. And so the completion or resolution rate, they vary by queue. The tier 1 that I mentioned is usually around 80%. Tier 2 is 60%. The percentage of calls answered within less than 300 seconds, that target rate again is 80%. The average speed of answer is less than 300 seconds. The number and percentage of calls abandoned is less than 10%. And again, that average talk time is around 12 minutes. So you can kind of see how the month of January compared to the service level agreement goals, we are definitely beating those goals and requirements. So that's a really great thing. All right, next slide, I'm going to talk about our interactive virtual agent. So we do have AI available for our consumers. And this last open enrollment period, we rolled out SAGE, and that's a very Nevada specific name for our IVA. And so this has been really helpful for a lot of those tier 1 and tier 2 tickets, where if a consumer calls in and they need to verify their phone number, their identity, they need to get transferred to an agent of record, or they need assistance with their 1095, they can utilize our interactive virtual agent SAGE. So here's some of the key features. There's a lot of self-service tools within SAGE. So they support our frequently asked questions. They check eligibility. They can guide someone to an anonymous shopping window. And again, request reprints, for example, if you didn't receive your 1095A form in the mail, they can, a consumer can go in and request this and not have to, wait on the call center during busy times after open enrollment. They can update consumer with a ticket status detail, for example, if they filed a ticket a couple of days ago. Again, those are like those document requirements for maybe the DMIs or qualifying life events during a special enrollment period. So the tool is designed to make the call center experience smoother for both consumers and for our brokers and navigators calling into the call center. We also have a broker and navigator service line, so that's different from what the consumers call if they need assistance directly. With direct agent transfers, calls from verified numbers with an agent of record go straight to you, so this again reduces delays. Yeah, and so I think we did a lot of testing with SAGE. Our quality assurance team did a lot of testing, and we're not tech people, so it was a learning experience for all, but definitely been a very helpful tool for a lot of consumers this last open enrollment period. And we'll continue to monitor and improve the features of our IVA as we go into the next plan year. Great. I'm going to talk a little bit about our Nevada HealthLink certified brokers. So brokers remain one of our most impactful enrollment channels, as I think you all know. This was nearly, again, 70% of our 2026 enrollments were broker assisted. So that level of engagement demonstrates the value consumers place on trusted local expertise. These brokers are selected annually. Navigators are every 2 years. And so when I say that they're selected, I'm talking about our broker award program. And this is something we're not required to do, but as a state-based exchange, we can do. And so we do a request for application every year for brokers to basically help assist Nevadans enroll in Nevada HealthLink coverage. So that is usually in the spring of every year. So we're coming up on that time frame again. They're performance-based, they're proposal-driven. Applicants submit detailed outreach and marketing plans, and then selections are evaluated internally by Nevada HealthLink staff. This ensures accountability and alignment with our enrollment strategy. The award funding provides enhanced marketing and outreach support, as I mentioned, specifically during the open enrollment period timeframe, which is our most critical window throughout the year, but it also is a grant that lasts through the whole year. So it supports special enrollment period as well. Both brokers and navigators provide year-round, no-cost enrollment assistance. This is our most important message when we talk about getting free assistance. Brokers offer plan comparison and direct enrollment expertise, and navigators focus more heavily on outreach and education for the uninsured and underinsured populations and provide unbiased guidance. Brokers drive volume and retention, but together, brokers and navigators expand reach across rural and urban Nevada. So the pictures on the right were our plan year 2026 broker awardees, and they represent Reno, Elko, and Las Vegas. So really excited to have representation, especially in the more rural parts of the state. Even though most of our enrollment comes from Clark County and Washoe County, there's a lot of people who still need to get covered in those rural parts of the state. So having and some expertise in those areas is really, really helpful. We can go on to the navigators. Thank you. All right, so as a state-based exchange, we are all exchanges are required to have a certified navigator program. So Nevada HealthLink certified navigators are critical part of our statewide outreach and enrollment infrastructure. Navigators provide, as I stated before, free unbiased education and enrollment assistance to the uninsured and underinsured Nevadans. They are trained and certified by Nevada HealthLink. They also register with the Nevada Division of Insurance, as do brokers, ensuring professionalism, compliance, and consumer protection. So while they are licensed assisters, they are not employed by brokers or affiliated with insurance carriers, so they do not collect a commission. Navigator organizations this last open enrollment period attended over 200 community events, demonstrating strong grassroots engagement. These efforts resulted in more than 50,000 direct interactions with Nevadans, helping individuals understand their coverage options and access financial assistance. So we do have, as I mentioned, the Navigator Award Program. And that is every 2 years, we go out for a request for application to hopefully get nonprofit organizations to become certified to assist Nevadans throughout the enrollment process. Navigators are also our primary event outreach staff. So you'll see pictures here of them out in the community. These are not enrollment events. It's more just providing informational and information and education about Nevada HealthLink to Nevada residents. So just to list our current Nevada Navigator awardees, we partner with Access to Healthcare Network, that's in Reno, the Asian Community Development Council, Asian Community Resource Center, these are both in Las Vegas, Dignity Health St. Rose Dominican Hospital, Nevada Health Centers, the Center, and I believe that's it. So not this year, but next year we will go out for RFA to hopefully increase the number of Navigator awardees that we have. Okay, I think I am done talking for a little bit, and I'm going to be passing this over to Katie Charlson, our communications officer, to talk about our open enrollment marketing and outreach campaign.
Thank you, Janelle. Can you guys hear me okay?
Yes.
Okay, good. All right, good afternoon, everybody. My name is Katie Charlson. I'm the communications officer with Nevada HealthLink, and thank you for the opportunity to provide an overview of our communication efforts this open enrollment. Our communication strategy is designed to directly support our core mission of connecting Nevadans to affordable, high-quality health coverage. We take a comprehensive multi-channel approach that includes earned media, digital engagement, social media, community outreach, and multicultural communications to ensure we're reaching Nevadans where they are. To strengthen and expand our efforts, we work closely with our marketing partners, the Abbey Agency, and our multicultural marketing partner, IC Media. Their expertise helps us develop targeted campaigns, culturally relevant messaging, and strategic outreach that allows us to effectively connect with the diverse communities across Nevada. Our focus is on making sure that Nevadans understand their coverage options, the financial assistance available to them, important enrollment deadlines, and new plan options such as Battle-Born state plans. Providing clear, accessible, and timely information is critical to helping individuals and families make informed decisions about their health coverage. You can go over to the next slide. And talk a little bit about our website. Our website continues to serve as a critical enrollment and education hub with strong year-over-year growth. NevadaHealthLink.com saw significant growth across all major engagement metrics during open enrollment. Total users increased by 36%, reaching over 512,000. Sessions increased by 41%, surpassing 1 million total visits. And page views also grew by 41%, totaling over 8.3 million, showing deeper engagement. Average session duration decreased slightly by 14%, which we view as a positive efficiency indicator. Users are able to find the information faster and navigate more effectively. Our website remains one of the primary conversion points for outreach, media, community engagement efforts, ultimately drive enrollment action. And on the next page, you'll see a little bit of screenshots of our landing pages. So we continue, you can go to the next slide. Thank you. We evolve our website every year with the help of the Abbey Agency to just reflect the new campaign, any new messaging that we need. We created a landing page this year for Battle-Born state plans, just helping Nevadans to understand this new coverage option. We updated the homepage messaging throughout open enrollment, including a timer to make sure we're effectively communicating our deadlines. We improved navigation and consumer-focused content to help reduce confusion and guides users towards open enrollment. We are always actively working on our website, trying to reduce content and make it as easy to understand as possible. Go next. We'll talk a little bit about public relations. So earned media significantly expanded Nevada HealthLink's visibility and credibility statewide. We secured 237 earned media placements across television, radio, print, and digital outlets. These placements generated an estimated 4.37 million coverage views, dramatically expanding public awareness. We completed 16 media interviews, allowing Nevada HealthLink leadership to directly educate Nevadans on enrollment, deadlines, and savings opportunities. Coverage included major outlets such as the Nevada Independent, Reno Gazette-Journal, Las Vegas Review-Journal, and multiple television and radio stations. Earned media plays a critical role because it delivers trusted third-party validation and helps us reach audiences who may not engage through some traditional channels. Media coverage also helped us educate the public about new programs, including our Battle-Born state plans, and also the available financial assistance and available free assistance through brokers and navigators. We'll go to the next slide. And to go along with that, we have a very robust community outreach. In-person outreach remains one of our most effective tools for building trust and reaching uninsured Nevadans. We have like a survey through our call center, and one of the questions is, how did you hear about Nevada HealthLink? And year over year, one of the top selected reasons is seeing us at an event. So during open enrollment, Nevada HealthLink participated in 82 community events statewide, and this was both in northern and southern Nevada, along with our rules. These events reached an estimated 63,000 attendees, providing direct education about health coverage options. We generated over 37,000 direct interactions with individuals, answering questions and connecting Nevadans to enrollment assistance. We also secured 17 event sponsorships during open enrollment. This just helps us expand our visibility and strengthen community partnerships. This included family festivals, cultural events, hockey games, community health fairs. This just ensures a broad and diverse audience outreach. These in-person engagements are especially important for reaching populations who may not otherwise see coverage online. On the next slide. talk a little bit about our multicultural communication and outreach. Multicultural outreach significantly expanded access and engagement with our historically underserved communities. We launched several first ever multicultural initiatives to improve access and awareness. This included Nevada's HealthLink's first Spanish language Facebook page, which now has over 2,000 followers and a strong engagement. That was launched in the middle of open enrollment. So ICE Media did a fabulous job, and we've seen a lot of growth on that. Our partnership with Telemundo included our first TV phone bank, and that generated over 150 calls, reaching over 50,000 viewers. Multicultural radio outreach generated over 1 million impressions statewide. We also participated in 12 multicultural community events, reaching more than 15,000 attendees. Outreach included partnerships with community leaders, Chamber of Commerce, and nonprofit organizations. These efforts ensure that Nevada HealthLink reaches all communities and fulfills its mission of expanding access to coverage. Next, we'll talk a little bit about social media. So social media performance saw exceptional growth, significantly expanding awareness and engagement. Total impressions increased by over 100%, reaching over 16 million. Engagement increased dramatically by over 4,000%, reflecting highly effective and compelling content. We'll talk a little bit about that on the next slide of kind of what we did differently this year. We also saw a large increase in our video views, increasing by nearly 750,000. Reaching nearly 11 million views. Our total social media audience grew by 75%, expanding our ability to communicate directly with Nevadans. And social media, as we know, plays an increasingly important role in reaching our younger, uninsured, and digital-first populations. We'll go to the next slide. So this year, we worked for the first time with influencers and some community organizations to expand our reach and strengthen public trust. This was, like I said, our first year working with local musicians and micro-influencers to promote open enrollment. Some of you may have heard on our commercial, we have a jingle. So we partnered with local musicians all over the state to sing our jingle and talk about why health insurance is important to them. We partnered with 16 micro influencers. This was incredibly successful and really just so fun to do. These partnerships just help increase our brand recognition and connect with some younger and harder to reach populations. We also collaborated with trusted community partners, including Community Health Alliance, Tahoe Night Monsters, the City of Las Vegas. You can see our beautiful Janelle there, who did some great trending videos and did such a good job. So we have collaborated posts all over Instagram. If you guys haven't checked it out, it's worth a look. It was really fun this year. We did a lot of different content, and these partnerships really allowed Nevada HealthLink to reach audiences through trusted voices, familiar community channels, and really just see real people out in the community. Overall, our communication strategy delivered measurable growth across every major channel, including digital, media, social, and community outreach. These efforts help us increase awareness and improve public understanding of coverage options. Janelle talked about our active shopping increased by over 20% this year. So we're really happy with those results and to continue to do this. And that is all I have. I will pass the mic back to Janelle.
Great, thanks, Katie. That was a lot of fun stuff, marketing, advertising, outreach. I'm really proud of our campaign that we pushed out with our vendor, the Abbey Agency, for this last plan year, especially with all of the changes that everyone is experiencing. But I think we really nailed the message on the head. So that's wonderful. Thank you. All right, so this is just a 4-month look ahead, probably a little bit more than 4 months, to be honest, but our meetings are quarterly, so just wanted to kind of give you guys a look into what the exchange will kind of continue to be actively monitoring and working on. And one of that is we're in special enrollment period season right now. So in order to be eligible for an SEP, a Nevadan has to experience a qualifying life event. And so what that could look like is if you have a baby, or if you moved to Nevada, if you maybe lost your employer-sponsored coverage and now are looking for health insurance coverage. Maybe your job income has changed. And so it's really important that Nevadans report that back to us because it could change your eligibility and what your premium assistance could look like. So other things that we're continuing to do is maintain and implement operational readiness for any of the upcoming federal changes, specifically for plan year 27 and 28. There were a lot of federal changes that Joseph is going to talk to you all a little bit about with HR1 and the Marketplace Integrity Affordability Rule. So there were specific impacts and changes for exchanges only. And so we're continuing to monitor what those impacts look like, especially as we go into plan year 27 as well as plan year 28. The exchange also continues to strengthen our partnership with Nevada Medicaid, as well as the Division of Social Services. And part of the projects we're working on there is our account transfer enhancements, as well as our periodic data matching project, so that we remain in compliance as we move forward with those requirements with CMS. So it's a lot of moving parts and a lot of partnerships, and we're excited to continue working on those as we go into plan year 27. We're also working on streamlining some policy improvements. That includes working on updating our broker agreements, our issuer agreements for insurance carriers, as well as broker and navigator onboarding. So we mentioned that we certify and train brokers and navigators in order for them to gain access to NevadaHealthLink.com and the enrollment platform itself, where the application takes place. So just looking at really, writing internal policies and processes down so that we are in compliance and we have that as a record as we mature as an agency. Believe it or not, we're already preparing for the 2027 legislative session. There were a lot of policy changes in 2025. There continues to be a lot of federal rule changes, but then along with that comes state policy and legislative changes. So we're already working on all of that. Then also as a result of SB4 that Joseph will talk a little bit about, we're working on producing a request for application for another navigator program. And this navigator program will support outreach and enrollment for the public option and Medicaid and qualified health plans specifically. We're also currently in budget building season. I think the governor's finance office budget meeting kicks off tomorrow. So we're working with fiscal teams across the Nevada Health Authority as we prepare for budget building. There's also a lot of ongoing release managements for operational annual processes. So the exchange works with our technology vendor, Get Insured. And just to give an example of what one of these look like, we call them 26.3 would be the next one. So that's March of 2026. Where there could be potential enhancements or changes to the system application. And then we release that, and then we do UAT testing on the system prior to open enrollment. So that's just kind of an example of what an annual process looks like for the exchange. I think that summarizes my remarks for the 4-month look ahead. Thank you all for your time and attention to my executive summary presentation, and I'm happy to take any questions that you might have at this time.
I just want to say, Janelle, that was really informative and easy to digest. I like the PowerPoint very much.
Yay.
So
no, that's really good
you.
feedback. We're all in this together, and it's a new process, so I appreciate that.
Yeah.
Yes, I would echo that. I found the marketing information to be especially helpful, and I think there's a lot of value in thinking about what's resonating with our consumers as that aligns with our Medicaid program as well. So I appreciate the detail and look forward to continued partnership on that.
Wonderful. Thank you, Anne. Okay, I think we are moving on to our next agenda item, which is number 5. This is another informational piece on the agenda, and I'm going to invite Marketing for Change, which is a subcontractor to our marketing agency, the Abbey Agency, to the presentation on health market research and some survey research results that they'd like to share with all of you.
Great, thank you, Janelle. We'll wait for the slide to come up. Should I share it from my side? Would that be easier?
That
You
might be a little,
certainly can.
yeah, I was
Okay.
gonna say that might be a little easier. Thank you.
Okay, that's what I'll go for here. And I just want to make sure that you guys are all seeing my screen. Research overview, fantastic. Well,
Yes.
thank you very much, Janelle, for introduction. My name is Aaron Metzger. I'm the research director at Marketing for Change, and we partner with the Abbey Agency and Nevada HealthLink, conducting research throughout the year to support the messaging and outreach campaign. Here you can see a little bit of our timeline. This is the timeline from this past year, and really we divide our research into kind of 2 real phases. It's the research that is supporting kind of open enrollment, is supporting of the messaging, as well as research that we conduct both during and then after open enrollment. So we actually just recently conducted all of our surveys. This last year, I'll talk a little bit about all the surveys that we just completed. And what those surveys do is then inform the next steps in our research. So really, it's an iterative process. We get a lot of information post open enrollment that we then use to fuel the research throughout the year. So right after we're done with our survey research, we jump into our spring formative qualitative research. And this research is really designed to help inform the messaging. So we conduct focus groups, online bulletin boards with Nevadans. And the goal here is to build on specific quantitative findings that emerged from our surveys, and then further investigate themes that then can inform specific messaging for the upcoming campaign. In addition, we often have focused on specific audiences of Nevadans. So in the past, we've focused on messaging research related to young adults, Spanish-speaking Nevadans, as well as gig workers in the state. And then after we take that information and then give it to the Abbey Agency for them to help create some messaging that we then test in quantitative creative research. So after the messaging is a little bit more closer to finalized, we actually conduct a survey in the state that allows us to test whether the messages are relevant and motivating for individuals, specifically the key future customers, self-insured and uninsured Nevadans. So the survey results really allow us to get an insights into which messages are resonating, and are they resonating differently for different audiences. And then that quantitative research then helps to finalize the final messaging that then is worked into the campaign. In addition, we also conduct additional research outside of open enrollment. It can take a number of different forms. Often it takes the form of research directly with brokers and navigators. Typically, we will invite brokers and navigators to give us feedback on our messaging, but we'll also utilize this research to investigate specific questions that might be more timely. So this last year, there are a host of policy changes that were affecting the market, and we conducted research to really get a sense of how navigators and brokers were affected by those changes, how they were ready for those changes, and how they anticipated informing customers about those changes. So this research really helped gain some insights into some gaps in broker and navigators' understanding of some of those upcoming changes, their preferred messaging and education channels. So what was the best way to get them some more information about those upcoming changes, as well as what they anticipated would be the most confusing points for the customers. So again, really got us some insights into help us prepare for those changes and potentially produce some education materials for brokers and navigators. So once we move into open enrollment, we support the marketing by conducting research on the enrollment data itself. So we partner with Nevada HealthLink and their data team to conduct analyses of the enrollment data. And this involves really pinpointing patterns of enrollment throughout open enrollment. And the goal here is to really target and get a sense of where we're seeing big gains versus losses. And we do this down to the zip code and really allowing us to target messaging and really allowing us to focus on where we're seeing gains, and not only gains at a state level, but really within the audiences we care about, specifically those that are uninsured and subsidy eligible. So again, this kind of targeted analysis really can help inform the messaging and get a sense of where we want to really put our efforts in messaging-wise during open enrollment. And then after open enrollment, we conduct a host of surveys, really with the design of a couple of things. First of all, conduct an evaluation of how the open enrollment campaign went, how the messaging went, as well as gain insights into how our consumers feel about the marketplace. So post open enrollment, we conduct a full population survey. This is a really robust multi-mode survey. We use text to web, email, phone line modes. And the goal of this survey is really to get a snapshot of the insurance situation in the state that really has a lot of very little error around our point estimates, really allowing us to get a very pointed, accurate estimate of the insurance experience for Nevadans. This then allows us to get a snapshot of the statewide insurance status. What are the percentages of uninsured do we have post open enrollment? What are the attitudes and behaviors and intentions of specific insurance statuses? It also measures the impact of the open enrollment marketing campaign. How many individuals did we reach with our marketing campaign? What was the impact of those individuals that saw our messaging? Did they differ in terms of their intentions or interactions with the website? We've done this robust survey now a couple of years, and this allows us to track changes year over year, so we can compare how data looked over the last 4 years. In addition to that full population survey, we also conduct specific surveys with subcategories of current enrollees and former enrollees. So we conduct a survey with current enrollees post-open enrollment, as well as what we call the leavers, so individuals that did not re-up their plans, allowing us to get some insights into the experiences that our enrollees have with the website. This really allows us to get insight into the shopping experience. So we measure a host of behaviors related to the shopping experience, how individuals experience the website, where the pain points are, where the positives are. This can also allow us to assess trends over time. So we've conducted this research multiple years, allowing us to track whether we see changes in enrollee attitudes year over year. And then we conduct a host of multivariate analyses, allowing us to predict what are the elements of enrollee experience that are most strongly associated with positive and negative views of the marketplace. Some of the data that we took from our survey, we then turned into an annual report. So we realized that we were collecting all this robust, rich data for Nevada HealthLink, and we wanted to turn this into a kind of a really easy resource so that Nevada HealthLink can become essentially the experts and go-to experts on the state of insurance in the state. So we turned our survey data into this annual review, this health industry report, which again, the goal is for it to be a real handy, easy resource for questions related to how Nevadans health insurance is experienced, as well as their attitudes and intentions related to health insurance. So again, this report is kind of a user-friendly way of seeing that data. And finally, we wanted to share some hot off the presses findings. So as we mentioned, we just completed a lot of our survey findings. Our first batch of analyses were really focused on assessing the impact of the messaging campaign during and prior to open enrollment. So really in this, what we do is include multiple measures assessing how individuals were exposed to messaging during open enrollment, and then tested through a host of analytic models the degree to which that exposure was associated with different attitudes and behaviors. So one thing we found is overall, we found that over a third of Nevadans at a state level were exposed to our messaging campaign, and that's a slight uptick at 38% compared to previous years in terms of individuals that recalled seeing the messaging campaign. And importantly, we found that individuals that were exposed to that messaging differed from those that weren't. Specifically, individuals in Nevada who were exposed to the messaging campaign had greater awareness and more favorable views of Nevada HealthLink, more positive ratings. They also were more likely to visit NevadaHealthLink.com and more frequently visit the website during open enrollment. And they are also more likely to recommend Nevada HealthLink to others if they were current enrollees. So again, this is kind of hot off the presses analysis as we continue to analyze this post-open enrollment data, but it kind of gives a snapshot of the fact that the messaging was impactful in terms of changing individuals' awareness, their attitudes toward the HealthLink, as well as driving, potentially driving behavior as it relates to visits to the website. And that's kind of an overview of our research. We're about to start up that process again as we analyze our post-open enrollment data and then utilize that data then to inform messaging for next year. I'm happy to answer any questions on that, on any research that we've conducted or will be conducting this upcoming year.
Thank you. It looks very thorough. Appreciate it.
Thank you. Well, I'm happy to answer any questions now or later in the presentation. I think I'm just going to stop sharing this so Janelle can have the screen back here.
Thanks, Aaron.
No problem.
Are there any questions or comments for Aaron, Marketing for Change?
I don't have any hands raised.
Okay. All right, I am going to turn it over to Joseph Philippes, our policy manager for the exchange, to do an informational update on federal and state policy.
Thanks, Janelle, and good afternoon, everyone. Can you hear me okay?
Yes, we can.
Thank you. My name is Joseph Philippi. I currently serve as the policy manager for the Silver State Health Insurance Exchange. As Janelle indicated, I'm going to give a quick, hopefully high-level overview of some state and policy updates that are impacting the exchange. So starting with state policy updates, Senate Bill 4 passed in the recent 36th special session last December. And the Division of Consumer Health Services, which our exchange lives in, we're currently working to implement Section 10 and 11 of the bill. Section 10, we are currently trying to finalize and distribute payments to brokers who assisted with the Battle-Born State Plan enrollment this past open enrollment period. The bill appropriated funding to distribute those payments. And then Section 11 allocates funding for basically a navigator grant program. The division is currently contracted with a vendor to help us develop the requests for applications for community-based organizations that are able to apply for the available grant funding allocated by the bill. And grant funds are going to be authorized for navigator agencies that provide enrollment assistance for Nevada Medicaid and Battle-Born State plans. We're currently planning to release that RFA later this spring. Moving on to federal policy updates, there's a lot to cover here, so I'm going to do my best just to kind of keep this high level and hopefully won't bore you too much. But as many of you are aware, in December of last year, the enhanced premium tax credits expired at the federal level. In January of this year, 2026, the Senate did vote to actually extend those tax credits for another 3 years. But unfortunately, the Senate has not taken up a vote on the measure, so really no movement at the federal level related to those. I will note that 2026 marks the first year since 2020 that enrollees in the marketplaces do not have access to these enhanced tax credits, and the overall impact on how many people will continue to use the marketplace remains unclear. And then these last three bullets here, the next few slides are going to go into more detail related to a couple different CMS rules and HR 1, also known as the One Big Beautiful Bill Act. So starting with the CMS Marketplace Integrity and Affordability Rule, that was finalized last year in June by CMS. The implementation of certain provisions have actually been stayed by a district court litigation that remains pending. The provisions listed on this slide are a couple of the provisions that are still in effect and that were not stayed by the litigation. For those interested, there's a link on the right-hand side of this slide to look at the list of provisions that are currently under that stay order. So as noted on the left-hand side of the screen, there will be a shortened open enrollment period for the upcoming plan year in 2027. The exchange is still determining the dates that Nevada's open enrollment period will be. But as this rule states, the open enrollment period cannot exceed 9 weeks in duration, and it would have to end no later than December 31st, which I know is different than typical years in Nevada. Our open enrollment period typically lasted until January 15th. Additionally, effective this plan year, 26, consumers must resolve all data matching issues within 90 days. They used to be allowed to have an automatic 60-day extension on top of that 90-day period, but this rule removes those additional 60 days. So any DMIs or data matching issues that are not resolved within that 90 days, consumers will either lose their financial assistance if they're eligible for that, or they could also lose their QHP enrollment eligibility as well. Moving on to HR 1. The bill was passed last summer. It was actually signed into law on July 4th of last year. The bill includes significant reforms to health insurance and health coverage, not only in the exchange, but also in Medicaid and Medicare. There are a couple provisions that are in effect now for plan year 26. It impacts the definition of lawfully present immigrants who are eligible for premium tax credits at the exchange. The bill exempts lawfully present immigrants who are not eligible for Medicaid and also have an income of less than 100% of the federal poverty level. They're no longer eligible for premium tax credits. And this population is unlikely to enroll in marketplace coverage due to the cost of the unsubsidized coverage. All premium tax credit recipients must now repay the full amount of any excess credits that are used. There was previously an income cap where if a person who made a certain income level at a certain income level would not have to repay the total amount of any excess credits used, but they removed that cap. So consumers have to pay the full amount going forward. And then looking ahead for plan year 27, there's going to be further changes to the definition of lawfully present immigrants who are eligible for premium tax credits. And it's also going to prohibit marketplace subsidies if individuals are denied Medicaid due to the upcoming community engagement requirements or the work requirements that are going to be in effect next year in January 27. So if an individual is denied Medicaid due to not complying with community engagement requirements, they'll also be ineligible for premium tax credits or other subsidies on the marketplace. And then moving into 2028, all marketplace enrollees will now be required to actively verify their application information prior to receiving any subsidies. It's my understanding right now that when a consumer applies and is eligible for premium tax credits, they're awarded those right away. But basically, if there is any information that the exchange needs for them to submit, they have a 90-day time frame to submit that information. But going forward, as of 2028, no tax credits or other subsidies will be provided to the consumer until they actively verify any information. So released earlier this month on February 9th, CMS issued a highly anticipated 577-page proposed rule known as the Notice of Benefit and Payment Parameters. for the upcoming plan year 27. It's currently just a proposed rule, so it's not finalized yet. We have until March 13th to provide any comments to CMS. And then the final rule date, as far as when it will be finalized, to be determined at the moment. It really depends on how many public comments I believe CMS receives and what they take into consideration there. But the payment rule is issued by CMS on an annual basis to adopt major changes for the next plan year. This proposed rule touches on several topics that would impact the exchange, including expanding access to catastrophic plans with even higher out-of-pocket costs, new rules for defrayal of state-mandated benefits, additional verification requirements for consumers, the elimination of standardized plans, and new policies to implement various provisions of HR 1, which this next slide is meant to go into a little bit more detail into some of those areas. So starting with the left-hand box on the top, the proposed rule would implement provisions from HR 1, such as narrowing the eligibility for premium tax credits for many non-citizen lawfully present immigrants. In addition, the proposed rule would implement the elimination of premium tax credit eligibility for individuals whose household income is below 100% of the federal poverty level and who are ineligible for Medicaid due to immigration status. Additionally, the rule would change transition requirements for certain exchanges that are not currently state-based exchanges that want to transition to become state-based exchanges. Those requirements would actually, some of the requirements would be removed or streamlined, giving states more flexibility and less federal oversight when establishing state-based marketplaces. And it also permits states to privatize the eligibility and enrollment functions, which I believe instead of having, like Nevada has, we have a website, Nevada Health Link, where consumers go to enroll and shop for plans. They're giving states the option to basically allow that to occur through different insurers or web-based brokers to kind of privatize that function. So the rule also requires state-based exchanges to establish a process to measure any improper premium tax credit payments that are administered by the exchange. So that rule, if passed, that would change. We'd have to start tracking any of those improper payments and submit reports annually to CMS. Additionally, the proposed rule would create new pathways for individuals to enroll in high deductible plans by raising out-of-pocket cost-sharing limitations and making catastrophic plans available to more people. The rule would also allow insurers to offer multi-year catastrophic plans with terms up to 10 years instead of the typical annual plan year. Additionally, the proposed rule would revisit several of the marketplace integrity rule provisions that are currently court stayed. The proposal seeks to reinstate these rules for 2027, and the rule would permanently require consumers whose income can't be automatically verified to provide more documentation, which could expand paperwork and verification steps for consumers. Related to network adequacy, the proposed rule would create newly allowable non-network plans, which place responsibility on consumers to shop for services from a wide range of providers to determine the best price. And the rule would also scale back network adequacy oversight requirements, including the federal time and distance standards, and expand state authority to oversee the network adequacy and essential community provider reviews. Related to essential health benefits, the proposal would require states to defray the cost or pay for the cost of most of the state mandated benefits that were passed post 2011. And it would also ban insurers from including routine adult dental services as an essential health benefit, which I don't believe Nevada currently has adult dental services as part of our benchmark plan, but just wanted to flag that. And just to summarize here, the exchange will continue to analyze this proposed rule and plan for the implementation as the rule is finalized later this year. So I know that was a lot of information. Happy to address any questions that you all might have.
Thank you, Joseph. This is an incredibly helpful overview. and I appreciate the complexity of all these provisions in HR1. I'm curious on the piece effective 2027 related to folks that do not meet community engagement requirements and how they are not eligible for advanced tax premium credits. Just maybe more of a comment than a question, but just acknowledging, I know from the Medicaid perspective, we're awaiting for the guidance from CMS on this, but would welcome if and when you all hear from the SSHIX side of CMS some information on that piece, we'd be eager to collaborate and look forward to working with you all on that. Recognize there's a lot of operational complexity to even identify that, and want to make sure that we're doing that in alignment with whatever we're getting from CMS, from our federal partners. So thank you for that. I appreciate it.
Absolutely. Thank you, Anne. And yes, I agree that all of the divisions within the health authority, we should all collaborate once further guidance is released.
Second
All right,
that.
not hearing any other questions, I'll stop sharing. Thank you all.
All right. Thank you, Joseph. All right. If there aren't any other questions or comments right now, we'll turn it over to Nate Osborne, our compliance manager, who's also wearing two hats as our data analyst, to provide an informational update on, to hopefully open up a discussion for the advisory board on an enrollment dashboard as we go into plan year 27.
Thanks, Janelle, and good afternoon, everyone. As Janelle mentioned, my name is Nate Osborne, and I recently moved into the exchange's compliance manager position, but I'm the former data analyst here at the exchange, and I'm excited to be here today to update the board on an exciting new initiative that we're working on, an exchange enrollment dashboard. Next slide, please. So what is an exchange enrollment dashboard? This will be a public-facing interactive data visualization report that can display aggregated metrics such as the number of exchange enrollees and their enrollee status, like are they pending or effectuated, the number of applications submitted, average premium and APTC amounts, enrollees by plan type, such as health versus dental plan or both, and metal tier, federal poverty level bands, age bands, and other attributes. All metrics can be tracked and compared over time and location. So we'll be able to drill down to maybe the county or service area level. And the end goal will be to increase transparency for all stakeholders in an easily digestible format and minimize data requests. Next slide, please. There are some great ideas from other states that are already doing something similar that we can emulate. For example, this is what New Mexico has on their website. And on the top left, you can select different views such as FPL summary, subsidy summary, weekly enrollment summary, which we're currently viewing now. And they have some nice visualizations under each tab. Next slide, please. Another great example is Maryland, and they have some additional views as well, but I include this very nice map visualization here that shows enrollment by county. And when you're on the website, you can actually drill down to each county and view county specific metrics. So super cool. Next slide, please. So how can we go about implementing an enrollment dashboard? We're currently in the early stages of developing one, and there are many tools that we could use to implement one, but we are leaning towards using Power BI, which is Microsoft's business intelligence and data visualization platform. It's a great tool for this project and has many advantages and will allow us to leverage our existing visualizations currently done in Power BI, such as the enrollment metrics that Janelle shared earlier in the presentations, which were created in Power BI. We'll also be able to leverage existing Nevada Health Authority tools and align with the Office of Analytics process. Currently, the Office of Analytics uses Power BI for their public dashboards, and we can utilize the same Power BI Pro license needed to display public dashboards. And in the future, there could even be opportunities for us to collaborate more closely with Medicaid and Office of Analytics in our reporting. We'll also be able to utilize the enrollment data snapshots that we currently take at the exchange. Each month, we take snapshots of the major data tables of our enrollment data. This is an automated process, and we can use these same files as our source files. And we'll essentially have full control of our data visualizations and refreshes. It will be very easy to make adjustments and fix mistakes. We'll also be able to align our dashboard with any compliance reporting or CMS data submissions and press releases, such as the one that we did right after OE. We can make sure the dashboard has those same exact numbers represented. And just to be on the safe side, we can exclude personal identifiable information or PII from the source files. So it will be impossible to access sensitive information while looking at the dashboard. So we still have a little bit of work to do to get this off the ground. Next steps include finalizing which metrics and visualizations we want to display, which is the fun part. Creating an exchange-specific style guide in Power BI so we can add our exchange-specific branding and colors. Establish a review process. For example, the Office of Analytics, I think every time before they refresh a dashboard, it goes to their PIO, which is probably a good idea, and refresh cadence. So one idea is maybe we do a monthly refresh outside of open enrollment, and then during open enrollment, we can refresh the data weekly. So while we still have a few details to iron out, we feel good about a target rollout date of April or May of this year. And next slide. That concludes my updates. More to come on this one soon. And any comments or discussion are appreciated. I see a question.
First, thank you so much. I am very, very excited about this. And I had two quick questions. One of them, you already answered it by saying April or May, because I immediately was like, when do we get this? My second question is, you said other attributes. What are you all conceptualizing? How many other attributes? Are you looking at race? Are you looking at sex, sexual orientation, like gender? Like what are these? What's in that bucket?
I think those details we're still determining. But
Okay.
yeah, I think demographic information is definitely a possibility.
Okay. Will you be
Thanks,
taking
Valerie.
feedback on it? Valerie, I see you have a question. Sorry, I was just gonna keep
Oh, go ahead.
going.
I didn't want to interrupt you,
Are
Taylor.
you
Go
are
ahead.
you taking feedback? So let's say, for example, you decide to opt out of something that the community feels is important for looking at data and looking at usage. Is this a living, breathing dashboard, or are you all paying the developer one time to build it and then we're stuck with whatever we get until okay, I see Jennifer's comment. All right. I'll stand down. Thank you so much. This is wonderful.
Thanks, Jennifer. Yeah, I was going to ask the same thing as who's going to decide what goes on here, because there's a lot of, and then my first question was, who exactly is this being built for? Is it for consumers? Is it for providers? Is it for brokers? I mean, who is the audience here, or who's the user that you're envisioning for this?
Honestly, I think it's kind of all of the above. Carriers, brokers, reporters, the board here. And and just to add to your question as well, Tara, if we utilize Power BI, we can we'll actually build the dashboard ourselves and host the data, so we can definitely make adjustments and continue improving it over time and adding and removing metrics.
And just to be clear, there's no interactivity, right? It's strictly informational. You don't go in and plug, interact in any way. Is that correct?
Right. You wouldn't be able to plug in any information, but we could like you could select maybe a rating area or service area and drill down to those specific metrics in that rating area. But definitely open to all ideas.
Yeah, and can I just interject? And I see your hand just went up too, Jennifer. But to Jennifer's point, the whole point of this informational agenda item was to facilitate a conversation for the board to gather feedback on what you guys think. As our advisory board, we would love to hear your feedback as we kind of go into developing what this dashboard could potentially look like. And to Nate's point, we aren't paying developers to do this. We would just be, I think, paying a small fee for the usage of the tool of Power BI, like the licensure. And then so we would internally be creating this and then putting it on our consumer facing website, nevadahealthlink.com, maybe even Nevada Health Authority, .nv.gov. So, Medicaid does something very similar. They utilize Power BI right now to put up their enrollment metrics. I think they do that monthly. I'm not really sure. Correct me if I'm wrong, Anne, but at least that's what they did in the past. So they did that on their Medicaid website. And so other exchanges in other states, they also have a publicly facing dashboard during open enrollment that kind of shows what their metrics is as they go through open enrollment. So we were like, oh, that'd be nice. We should do that too. Let's see what the board thinks. So there's a lot up for discussion and nothing's been decided upon yet, but and we do publish some information like the slides that I talked about today. We have a monthly carrier meeting, and so those slides are posted on our website. So you can see that there is reporting requirements that we're also required to report to CMS and SSIO during open enrollment, things of that nature. So we do, publish public metric information, but I think this could be a really nice visual representation during open enrollment and beyond. I see Jennifer's hand went down, so maybe I covered what she wanted to say. But Tara, I see your hand is up.
Yeah, I just wanted to again stress the importance of this from a funding perspective for organizations too. Like there's a lot of national funders that use this data to determine what states they want to invest in. So the ripple of this being publicly available and digestible is huge because it will save, nonprofits across the state from having to do the Office of Analytics requests and wait for those. As far as what some of the other attributes, I want them all. I'm happy to jump on a call later and talk about what and why might be helpful. And again, that's me thinking of the work that I did with Kids Count in the past and just how we utilize that information at Children's Advocacy Alliance to apply for initiatives that funders have nationally. So.
Those are all really good points. Thank you. And I love the enthusiasm, and I'm glad that you're excited just as much as we are.
One data point that comes to mind from my Medicaid perspective, firstly, would be that group, I'm having a helpful conversation with Jen to help me understand the complexity of the way that we track folks that may be Medicaid eligible that have selected a plan on the exchange, and how we identify and connect them to other resources. And so maybe this is not a phase 1 data point, but a long-term data point. I'd love to be able to see our tracking on that to determine of the group that meets the income requirement, so those kind of 2 FPL levels below 138%, or ranging depending on eligibility groups, right? How many are indeed Medicaid eligible, and what's our disposition on those folks? Recognize there's much more complexity to that, so I don't want to add that, Nathan, to your kind of phase 1 list, but would love to kind of table that, as I think it is a very important and helpful angle for us to ensure that consumers have access to all the choices that they have available.
Thank you for that feedback, and that's a good idea. Maybe for a later phase, definitely a good one.
All right, well, we will take that feedback back, and just moving through the agenda, I think we're on item number 8. This is another opportunity for public comment. Again, just a reminder, no action may be taken upon a matter raised under the public comment unless the matter itself was specifically included on the agenda as an action item. So I think if you're on the phone, you can press *5 to raise your hand, and then comments will be limited to 3 minutes per person, just as a reminder. Oh, I see a phone number raise their hand for public comment. Please go ahead.
Can you hear me?
Yes.
Hi, this is Heidi Sterner, Sterner. I am the past NABIP Nevada State President and Ledge Chair. I am currently the Southern Nevada NABIP President. And I wanted to say thank you to everyone for the work that you did. You are all very familiar with the fact that there were a lot of brokers that weren't going to get paid for work that we do. And you went to bat and you were able to, in some way, rectify that. And I want to make sure that you know how much we appreciate the fact, because you didn't have to do that, and we would be getting paid zero. So I wanted to express on behalf of our members and brokers in general, thank you for that. And I do hope to work with you guys, and I hope you guys are working with the carriers in this next ramp up for 27 to hopefully make sure that doesn't happen again, because that would have really prohibited a lot of brokers from being able to help members enroll anybody into the battle-born plans, just simply due to the fact that they didn't have access to be covered by their E&O insurance. I mean, that's a vital piece, that if we don't have coverage for E&O, we cannot sell a plan. So that's very important on the broker front. So we want to make sure that we said thank you for the efforts that were taken by whomever they were taken by to make sure that something was done and in the respect that you guys did. Thank you.
Thank you, Heidi, for your public comment. Thanks for joining our meeting. We appreciate your time. Thanks. Okay. Remind me, Veronica, I think we have to have a motion to adjourn the meeting. Is that correct? Or can I just adjourn the meeting?
I think I move that we adjourn the meeting.
Happy to second.
All right. Motion carries.
That works.
Thanks, everybody.
Thank you so much. Appreciate it.
Thanks all.
Thank you. Have a
Thank
good day.
you.